We're going to do a webinar on group therapy specifically, and I have some very specific ideas about group therapy. Let me make a couple of comments before we get going. The type of group therapy that I'm going to be talking about tonight, generally speaking, is for rehabilitation, behavioral health rehabilitation, mental health, and addiction and substance abuse. Not so much outpatient. However, we are going to touch on those factors, and I do want to make a disclaimer that the themes along with group therapy and the layers that are associated with it, it doesn't really matter what level of care a group is done in. There are certain principles that apply to all groups. Whether it be process group, psychoeducational, medication management, so on and so forth. So I'm going to take you through just my sort of my expertise in group therapy. I've been doing group for over 25 years, and I thoroughly enjoy it. It's a phenomenal experience, and group is a living, breathing organism. It really is. It has its own personality. It has its own ups and downs. It has its own beginning and its own end. It's got everything from excitement to drama, to boredom, to goodbyes that could be very emotional, successes, failures, so on and so forth. So what is group therapy? Group therapy at the basic level is a form of psychotherapy that involves one or more therapists working with several people at the same time. I mean, that in and of itself is a very general and basic definition. It usually complements individual therapy and sometimes medication as well, although it may be used as a standalone treatment for certain issues or problems. And the type of standards I'm talking about in rehabs is about 80% of the treatment occurs in rehabilitation. And so I wanted to share with you little theories about group therapy, specifically from a doctor whose name is Irv Yalom, Yalom. I highly recommend that you read anything that Dr. Yalom produces. To me, he's the godfather of group therapy. He's one of the reasons that I entered the field of behavioral health, and he extremely motivated me because he was able to take key elements of group therapy and make sense for me. So Yalom had a theory, and his therapeutic factors of group therapy, there were 11. It's universality, hope, information, group cohesiveness, catharsis, socialization, altruism, interpersonal learning, existential factors, corrective, recapitulation of the primary family group, which is a mouthful, and imitative behavior. We're gonna talk about all of those things, and so right off the bat, I want to get into these 11 factors. And again, you can apply all of these characteristics to any group that you're doing in drug rehab, mental health facilities across the country, outpatient, inpatient, psych hospitals. It's just a variation of how you utilize it. So the first thing that I want to talk about is the concept of instilling hope. Hope is a tremendous characteristic when it comes to group therapy. When you walk into the rooms where there's a group going on, you are part of a bigger entity, and these folks that are in there are a mirror of what you are, either what you were in the past, what you are currently, and what you might be in the future. And the way that hope works in group therapy is, first off, the clinician needs to establish the fact that hope does exist, that you're not a number, you're not a statistic, you're not, it's not gloom and doom. Not all people fail that go to rehabs. Not all people succumb to their mental illness and their addiction. Not everyone is constitutionally incapable of recovering from whatever ailment that they have. And so the group relies heavily on the genuineness, empathy, and compassion of the group leader, in this case, the professional. And then along those lines is what the patient's experience is outside of the group process. So one of the ways in which to instill hope is to is to get the group discussing, when did you have hope? In what time in your life, and what were the situations that you had hope? How did that show up in your life? Was it through a mentor that you had? Was it through a family member? Was it when you were involved in the 12 steps of recovery? When you were taking medication? And then you always want to ask those questions in terms of the characteristics of something like hope. But you also want to ask the other way, which is, at what point did you not have hope? Who perhaps influenced you not to have hope? What were you doing? Did you stop taking your medication? Did you stop going to the 12 to AA and NA and practicing the 12 steps? What was really going on? And so, as a therapist, you want to talk about both sides of hope, that you have hope and that you don't have hope, and where you get it from. And the clients need to talk about their experiences, because everybody is different. Everybody has their own story of hope and getting through things and all of that other stuff. And just because somebody is sitting there doesn't mean that they didn't have hope or they weren't successful at some point. And so that's what hope is, and that's how it shows up in the group process. It has a lot to do with level of motivation. It has a lot to do with optimism. And one of the things as a clinician that you can do is use optimism as a strategy. Optimism is not this sort of pie in the sky, hey, everything's going to be better because my name is, Joe Smith. Optimism is used when you can constantly think about negative aspects and then be propped up by the clinician and by the group and looking at things very optimistically, that you may not get everything you want, but you can get some of the stuff, and you can get it faster than you think that you can. The next characteristics of group, as related by Irv Yalom, is this concept known as universality. So what is universality? It's just being part of a group of people who understand what you're going through and have experienced similar problems. It will help clients see that they are not alone and that their suffering is universal. So one of the greatest examples of that is the rooms of AA and NA, and then of course Emotions Anonymous, Cocaine Anonymous, all of those type of self-help type of groups. And so why is that important? So here's how I view it. If you go to a doctor, you get medical treatment, and he hones in on the disease that you're having, and you focus on that area. Either you heal or you cut something out, or you take some type of medicine. If you have a spiritual dilemma, you go to a rabbi or a priest, and they give you a spiritual answer for your malady. If you go to something like AA and NA, you're going to a place that shows you who you are and gives you this sense that you're not alone, that everybody in that room is suffering from the same exact thing. And basically, someone who is not in a room like that can be in a stadium of 80,000 people and still feel very much alone. And that when you walk into the rooms of AA and NA, just as an example, but it's also group therapy, and you know that everyone in that room has experienced something along the lines that you have this concept of universality. And again, it doesn't have to be AA and NA. It could be a depression group for adults or adolescents. It can be an anxiety group, learning coping skills on how to reduce your stress as it relates to anxiety. And there is nothing more powerful than the group think and coming up with solutions from people that have already been there and done that. I cannot tell you these first two characteristics of hope and universality, how beneficial they are and how much better they are than any medication that is out there, even though we know that medication is extremely effective. So the third characteristic is called imparting information. Imparting information is extremely critical, and it's a massive part of the group process. What does it really mean? It really means two things. Number one is the group leader, the clinician, is a resource for the entire group. And then, of course, the group is a resource for the group and for the individuals. And basically it goes like this. When you go into a group and you are depressed and, you're talking about your depression, and you're talking about characteristics. I sleep too much, I don't eat, or I eat too much, or I don't exercise, or I tend to isolate. That's fine, but the group can redefine this concept of depression. Depression is really misleading. Depression reminds me of like a road sign on the side of on a street or a highway. Oh, depression's coming. Be careful. Make sure you have your seatbelt on. It's going to be bumpy. The road is going to go up and down. It really should be the dark abyss of nothingness is really the way that people should describe depression. As saying, I'm depressed, I'm actually in the abyss of darkness and I see no way out. That hits home a little bit more. The other thing is that breaking down stigmas and stereotypes of people that are mentally ill and drug addicted. Years ago, the general public used to believe that addicts are homeless, they're under a street, they're under a bridge, they push around a shopping cart and they steal and they really should be in prison. They're all criminals and they're really on the fringes of society and not even human beings. And of course, nothing could be further from the truth. I mean, your brother or your sister could be a drug addict or mentally ill. There's a misnomer now in the media that mentally ill people are violent because some schmucks take out guns and they gun down these children that are in schools, and somehow that correlates to the mentally ill being violent. No, that correlates to that person being sick and twisted and having very poor parental skills and guidance to help him out. That's a systemic issue, more than anything else. So really shattering stigmas and stereotypes is massively important. A mentally ill person, a stereotype of a mentally ill person is that they're not smart. Somehow they're retarded or mentally challenged. That's just completely bunk and completely, it's not even politically correct anymore. It's actually ridiculous. There are people that are mentally ill that are thriving and have thrived. They're very successful businessmen and teachers and really anything else that they put their mind to. So the fourth element is altruism. Group therapy gives members a chance to practice altruism to help others in the group and experience that they will likely help them as well. So altruism in day-to-day, in your day-to-day life is few and far between. Most people will not do things simply out of altruistic reasons, that they want nothing in return. Group therapy done correctly is actually the opposite of that. Altruism, in its truest form, is a patient giving another patient feedback and expecting nothing in return. They're just doing out of a sense of empathy and compassion, and vice versa. That the person that got the feedback would give feedback. A very, very powerful element to the group process. The fifth one is the tongue twister, is the $25 word one, which is the corrective recapitulation of the primary family group. So basically what it's saying here is that no matter where we come from, we came from a starting point. We had a home, we had a family, we had whatever that definition is for you these days. And we reenact that family group and that process. Many of you can identify with that because you're identified as the black sheep of the family. You identify when you go back to family reunions that you end up, despite all your work, you end up in that same bucket that everybody used to put you in, whether it's a nickname or your behavior was immature or whatever it is. And you find yourself behaving in that way, and you don't even want to. You don't even realize it. So, in the group process, there's discussions on how to either accept these reenactments, right, and then work through them. How can I practice that, right, so I'm ready when I'm dealing with my family, or choosing different behaviors that get us away from the primary group thought process. Again, this wordy principle refers to the process of clients learning and exploring their childhood experiences, personalities, behaviors, and feelings, and learning how to identify and avoid destructive or non-helpful behaviors. So basically, let's hear the narrative. There's a different perspective, and a group can help individuals with that perspective. Even if you buy into the narrative of what you have experienced over and over again, if you're open to the fact that maybe there's a story here within your narrative that would make sense to you. And so the reenactment of the family group, where you come from and how you behave, is extremely powerful and impactful. Patients travel thousands of miles to get away from their family, and it doesn't help them at all. So the sixth thing is development of socialization techniques. This simple experience of working in a group provides excellent opportunities to socialize, practice new behaviors, and experiment in a safe environment. So a lot of people in group therapy, again, anxiety, depression, addiction, substance use, the reason that they're all those things is they don't know how to socialize, they don't know how to talk to people. I mean, how many of us hate small talk? How many of us just don't know what to say? How many of us would rather just stay under the covers or watch TV or stay at home? Which, of course, all of those things have its appeals, But nonetheless, it is important to learn how to socialize. Why? Because at its foundation, we are social people. We are individuals that need the interaction of others on some level. And so the development of social techniques and sort of these cues, as a mindset are extremely important, and again, make for a highly productive group therapy process. Number 7, clients can observe and imitate or model positive and helpful behaviors towards others in group, including the therapist. This is where the therapist is a role model. And just as an aside, as a group therapist, you're not just a group therapist. You're a role model, you're a leader, you're a teacher, you're an educator. You end up could be their priest or their rabbi. You're also an entertainer on some levels, sometimes a stand-up comedian. But being able to imitate appropriate behavior is critical. I'll give you an example. There was a therapist who was in a rehab, and one of the patients destroyed his bookshelf. And this therapist loved to read, and the bookshelf was destroyed, and it lay on the ground. And the therapist was very, very upset. The therapist did the right thing, and they went to their supervisor, and they said, "I don't know what to do. Should we just discharge this patient?" So the supervisor, being full of wisdom and being very bright, kind of put it back on the clinician. Well, what do you think the best the best thing to do is, as it relates to this patient, as it relates to the community, say 10 or 15 patients that were involved? So the therapist thought about it for a minute and frankly did not have an answer. And so the supervisor suggested to him, more than suggested to him, that if you're angry, which you are, is that you should role model that behavior, because anger is not necessarily a bad thing. And the therapist, who was pretty new with their position, was like, "I can get angry, I can show anger." And the answer is yes. You can show anger towards patients, and you can role model and give the patients an idea that you can imitate behavior. That's absolutely healthy, and it should happen. And so the group went on, and the therapist discussed how angry they were at this individual, and then they opened it up to the group, and the group talked about anger and anger management, and the end result was a couple things. The patient apologized for his behavior. They discussed the process of his anger, and he also fixed the bookshelf. And another thing is that the therapist put up some pretty good boundaries. And so in that process, the patients are now more likely to imitate what the therapist did. Did he get angry? Yes. Did he hurt anybody? No. And he helped the situation. So pretty cool example of how you imitate and, of course, role model behavior. The 8th thing is called interpersonal learning. Interacting with the therapist and other group members and receiving feedback can help a client learn more about themselves. So this is done in a lot of different ways. Sometimes it's done in confrontation. You see a behavior, you don't like it. The group members, they call you on your behavior and say your behavior stinks. We like you, but your process is terrible. And you need to start to rethink how you're accomplishing things, because you're really not accomplishing anything, and everybody in the group is seeing it. So that's that is number one, that they get feedback about how they are interpreting the facts of life, so to speak. So another way to do it is to discuss facts, not fiction, but facts about your diagnosis, your treatment plan, your discharge plan. And so when you hear facts and you don't have those facts and you're hanging on to certain beliefs, this sort of learning process is going to help either get rid of these irrational beliefs, reduce them, and certainly get somebody to be more open-minded. So interpersonal learning is you see it a lot with a lot of psychoeducation, a lot of conversation surrounding the topic of whatever the psychoeducation is, just really building up insight. And that is one of the key factors in a group therapy like we're talking about. You're dealing with patients that are probably pretty intelligent but have no insight. So number 9 is group cohesiveness. Group therapy sessions can facilitate a shared sense of belonging and acceptance of one another. The patients start to care about each other. They can joke around with each other. The rules actually mean something. The timing of the group process is important. Looking out for each other, talking about personal things outside of their diagnosis. This all leads to sort of group cohesiveness and the building of culture within the group process. Number 10, catharsis. This principle is based on the healing power and sharing of others. Talking through your feelings and experiences in a group can help relieve pain, guilt, and stress, and shame. There's almost nothing like being able to have a cathartic moment and not be judged. Shame and guilt often dictate what the how a person behaves and what they're going to share and what they're not going to share. And then number 11 is existential factors. Although group therapy offers guidance and support through the group, it also helps clients realize that they are responsible for their own actions and the consequences that follow. The set of principles makes it clear that there are many advantages to working with the group rather than an individual. And one of the existential factors and one of the key elements of somebody being successful in a group process is to understand and accept that they matter and their behavior impacts themselves and other people, because that has the foundation in empathy and compassion. And when you have insight that you're actually impacting another human being positively and negatively, it's outside yourself, that's an existential factor. So those are the 11 factors of group, as said by Irv Yalom, that is used whether clinicians know it or not. But this is a format that you can do, and it's interchangeable. Just to move right along, the types of therapy groups is self-help, is medication or management groups, medication education. Interpersonal therapy groups, that's a deep dive into the group members' relationships, focus on the present, not the past. Encounter groups are immersive and intense group situations, usually confrontational, specifically to behavior and how the individual group behavior affects the group as a whole. Psychodrama Group is another one, sort of the reenactment, a lot of times, of the family, how to change things, literally giving somebody a script. I like to call it a fishbowl, where you will have 3 or 4 people in the middle of group, and they will be reenacting maybe something that constantly occurred in their family environment, and how they're discussing it, exactly how they're saying it. And then outside of the group, the people are looking at behaviors, language, tears, anger, sadness, happiness, all of that. So that's very, very helpful. The general tone and direction of the group therapy sessions will vary depending on the type of group. There are many different kinds of groups with different areas, but they generally fall into 2 categories: open and closed groups. An open group, and you'll see this in AA and NA, is that an open group is for people that are in recovery and not in recovery, and a closed group would be just for people that are honed in on recovery, probably some long-term recovery. Pretty cohesive group. So, in terms of what will actually happen in a group session, this can vary, but basically 8 to 9 is the essential number for group therapy. Essentially, you have chairs around in a circle, which is very important. You shouldn't have chairs in the circle and outside the circle people prop up their feet or lean the chair back or anything like that. You should have basic rules. Make sure they understand confidentiality, what's called cross-talking, so people don't talk at once, perhaps raise their hands, perhaps share and identify, especially when people hit home to them. There's also different styles. For example, there could be plan groups, which are usually psychoed with a handout. There's a free form group where sort of a loose agenda. Therapist is not really sure what directions go in. Maybe has some ideas, but not exactly. In terms of the rules and guidelines, again, confidentiality, commitment to attendance, no socializing with group members. This is an interesting one. Group therapy is not a social activity. It's a therapeutic one. Forming close friendships or other bonds with group members can interfere with the group's success, especially if members become hesitant to share personal information because of another group member. Friendships should be saved for after the group has disbanded. I don't disagree with it. I know that in some areas and in smaller environments it may happen, but the point is true. If you develop a friendship or a romantic relationship and it goes south as it normally does, the group can actually disband and not be as cohesive. And trust is a major factor. Communicate with words, not actions. This rule could be considered the exact opposite of the standard advice storytellers receive: show, not tell, right? People have different reactions to physical contact, so expressing yourself through words instead of physical action is an important rule to follow. Why? Because we must communicate. Giving somebody a hug it could be a bad message and bad boundaries. That comes later. Share. Open up, talk about your issues and about your thoughts and your feelings. And participation. I know it's common sense, but you can't sit there like a bump on a log. This is not having a beer in a bar and bullshitting with somebody. This is not going out to dinner. This is group therapy. On many levels, we're dealing with sickness and what I call, pathology, and we're there to work. It's a working group to reduce your anxiety, to reduce your depression, to manage your symptoms, to gain further depth into your recovery of drugs and alcohol. So that is, in essence, group therapy. This is some of the key guidelines that you can use in the group process. I will add more to this on a weekly basis. But I did want to give you an outline and some insight, and I promise you that if you use these techniques and this style and this format, you will have a successful group. Thank you very much.